Hello and welcome. Moss Adams is pleased that you've joined us for today's session, Identify Top Risks for Your Healthcare Organization. And before we begin, I'm going to play our housekeeping video.
Welcome, and thanks for joining. We're pleased to present our continuing professional education webcast series. Before we begin, please keep the following in mind. You can customize how you view our presentation and interact with the presenter. For better viewing, close all other applications and turn up your speaker volume. You can adjust window size and placement or enter full screen mode using the controls at the top right of the window or dragging the bottom right-hand corner to resize. At the bottom of your screen, you'll see a series of icons that relate to a different aspect of our session. You can download a PDF of today's slides from the Slide Deck and Handouts widget. You can ask questions by typing in the Q&A window and clicking Submit. We'll do our best to answer all questions or follow up via email. If you experience technical difficulty, refresh your browser by hitting the F5 key. Today's session offers 1 CPE credit. To receive credit, you must meet the National Association of State Boards of Accountancy requirements. You must attend at least 50 minutes of the session and respond to at least 75% of polling questions. To participate in the polls, please check the button next to your answer within the slide window and click Submit. We'll track your progress and alert you when you've earned CPE credit. You can then click the certificate icon in the CPE Progress widget and download your CPE certificate. Don't worry if you can't download your CPE certificate today. We'll email you a copy in 2 weeks. If attending this webcast in a group, you must complete our group CPE attendance sheet, available in our Slide Deck and Handouts widget to receive credit. Please have all group members sign it and send only 1 sheet per group. CPE credit can only be awarded to participants registered as themselves and isn't available for participants who view the on-demand version. This presentation is not legal, investment, or accounting advice. We encourage you to seek the counsel of a professional service provider to apply this content to your specific circumstances.
All right, we have a couple presenters with us today from Moss Adams. We have Melaney Scott, Director, and Tyler Ribail, Senior. Their bios and contact information are located in your webcast console. And now I would like to turn the floor over to Melaney to get the presentation started.
Wonderful. Thank you, Amy. So good morning or afternoon, everyone, depending on where you're at this today. Very much looking forward to sharing some information with you. And here's a little bit about what we'll cover this morning. We're going to talk about really why are risk assessments important for your organization. We'll also discuss some considerations for conducting a risk assessment, and as well, we'll top it off with discussing some top healthcare risks and see how that may resonate with your organization. All right. Why risk assessments matters. But before we jump in, we've got a polling question, Amy.
All right, thank you. So the first polling question is to get a feel for who's with us today. So it is, what entity type do you represent? And your options are provider clinic, hospital, tribal health, skilled nursing facility or long-term care, other healthcare provider, or other non-healthcare provider. And the polling questions are located right on the slides that we're presenting. And if you can't see it, you may need to hit the F5 key to refresh your console. And then to respond, you're going to click the button next to the answer you choose and then hit Submit.
Wonderful. And I don't know, sometimes it's always fun to know where folks are participating from today. So if anybody's interested, you can put that in the chat box where you're from. I'm actually from, depending on how it's framed, either Central or Eastern Washington today.
All right, and while people are doing that, here are the results for this poll.
Oh, wonderful. Thank you, Amy. So it looks like we've got pretty much folks from hospitals and a few of another type and non-healthcare providers as well listening in. Great to see some tribal health folks and clinics as well. So it looks like we have a good smattering of representation this morning. Thank you. Okay, so a little bit about when we think about why really are risk assessments important for our organization. And we've got listed here several different organizations, law, the Stark anti-kickback as well. But when we think about some of these, especially for example, the U.S. sentencing guidelines, those are the framework by which regulators will take a look at how an organization is identifying and assessing and addressing risks. So also some of these organizations might pertain to you. Generally, the CMS would probably for most folks be applicable. Food and Drug Administration, HRSA, state and local agreements also often have information around programs and risk assessments. Any kind of research we might be involved with. So really pretty much most avenues where we are involved in our day-to-day business, there's going to be an underlying facet of an anticipation that our organization has some risk assessment activity occurring. And then also thinking about when we think of our governance aspect, the American Health Law Association, also known as AHLA, as well as the Office of Inspector General, or the OIG, they also have some compliance guidance for boards. And there's several pieces around this, but they all touch again on how is governance being kept apprised of risks and how those risks are being handled. And while this does indicate compliance guidance, this is applicable for pretty much every facet of our organization, whether that be in our finance team and complying with state requirements, payroll requirements, kind of all of those pieces all wraps up into that, not just what might fall within our, say, dedicated compliance department of our organization. And in addition, the Institute of Internal Auditors, or the IIA as it is often referred to, has some very specific information as well around the board, has the overall responsibility for managing risks. And oftentimes, as we know, that is delegated down to the operations side, who also has responsibility for identifying those risks and managing them as well. So it's across the organization, but all kinds of resources points to, again, that anticipation and expectation that we have some mechanism at our organization for identifying risks. And when we think about it, really the best way to identify and address risks is through a risk assessment. And so when we think about this, like, why then would we want to conduct a risk assessment? So first and foremost, it really will support an overall enterprise risk management program or philosophy. And that's a whole other, like, we could definitely spend an hour talking about enterprise risk management. And by the way, if that would be an area of interest, let us know. We are always interested in what topics would be of value and interest to participants. I think one of the biggest ones is this fourth bullet point here around revealing risks across the organization. Oftentimes, there are different departments or groups, such as if we think about risk or quality, compliance department, and they are all taking a look at risks that falls within their purview and how they're addressing those risks. However, a full entity-wide risk assessment will take and look at this from a holistic standpoint, because oftentimes risk doesn't just sit in one area. It touches many different areas of an organization. So there's a really good value in pulling this up and out of, say, individual siloed segments of the organization, but really a holistic look at what the risk landscape is for the entirety of the organization. I will also say it definitely also fosters continuous improvement initiatives, because as you're addressing risks, that does help for the improvement across the organization as well. Oh goodness, so in an endeavor to make sure that we do get your CPE for today, Amy, it looks like we are geared up for polling question number 2.
All right, thank you. So the second polling question is, my organization conducts an entity-wide risk assessment, and your options are A, every 2 years and monitors for emerging risks, B, annually and monitors for emerging risks, C, every 2 years without monitoring, D, annually without monitoring, E, has not yet implemented an entity-wide risk assessment, or F, entity-wide risk assessment. Tell me more.
And thank you, Amy. And when we think about, say, A and B and C and D, really what that's considering is if we're just doing a full entity-wide risk assessment, say on that cadence of every 2 years or annually, but we're not necessarily monitoring and adjusting as we go along during those time frames, versus C and D is we're not adjusting and looking, but A and B is we're doing the formal, but we're also informally monitoring and potentially adjusting for risks that might be emerging, just to provide some distinction there. And thank you so much for folks who did say where they're from. We have some folks from Texas, some from Oregon. Oregon's my old stomping grounds, born and raised, so always nice to see folks from there too, and was just in Texas not too long ago as well.
All right, I'm going to pull up the results here.
Great.
And there you go.
There we go. Looks like folks are actually what was oftentimes considered ideal is that annually, and then watching for risks that might be emerging and making adjustments as might be needed. So that's fabulous. So either we've got most everybody is every 2 years, or every annual or every 2 years with and without monitoring, or primarily with monitoring. So that's wonderful. Okay, great. Thank you so much. All right, so we're going to turn our attention, and Tyler's going to talk a little bit more around some of these risk assessment considerations.
Thank you, Melanie. As mentioned, my name is Tyler Ribail, and I am a senior, and I actually sit in Minnesota. So not in Portland or Washington or Texas like some other folks, but over here in the Midwest. So when looking at assessing and managing risks, we kind of like to think of it as a continuous ongoing process that is made up primarily of these 4 parts. And so it begins with identifying your risks and then kind of assessing the magnitude of those risks, how we want to respond to them, and then how we want to kind of continually audit or monitor them. And we really like to illustrate this in a circle to, again, kind of elaborate how it is a continuous process that also then does foster continuous improvement, because as the environments in which we operate in change, so do our risks and the potential risks that we can face. And so by continually identifying risks on an ongoing basis, like it seems like a majority of you all are doing based off of the polling results, it really sets you up for success to kind of see what risks could potentially be coming down the pipeline that then need to be addressed in the future. And then one way we like to kind of look at potential risk factors is through the lens of them either being objective or subjective. And so when taking an objective approach, I kind of like to think of it as like we are looking at risks to try to either stay compliant and make sure we're compliant with the federal and state regulations in which we operate under. We can also kind of take it through the lens of looking at misuse and making sure that there is no misuse or misappropriation of state and federal funds within the organization, or just looking at like financial, do we have the means that we need to continue operating in a way that we feel is sufficient, that is in alignment with our strategic goals and initiatives, so on and so forth. You can also look at it through kind of a subjective lens, and that is really just internal audit or folks having conversations with various parties throughout the organization to see kind of what percolates and is top of mind for them for risks. When communicating with clients and kind of having this ongoing basis, we notice that the risks are really dependent on where folks spend the majority of their time. So if you're communicating with someone who is on the accounting team, they might have very different risks than folks who say are on the facility side or in purchasing or any other department. And so kind of seeing what subjectively is top of mind for them is also a really great way to identify and assess some risks and see kind of where they want to focus on, or areas that they think could potentially, really balloon up to something that other people might not initially see. When looking at the key components of the risk management, we kind of, again, like to look at identifying, scanning, assessing, and responding. And although this slide does call it out, I want to also mention that scanning is kind of a subset of identifying, and we'll go into more detail about that a little bit later. But there is some overlap, so just wanted to make sure that we do call that out. When we looking at identifying potential key components, one thing that we really like to do is kind of ask some introspective questions and, look at the potential exposure that an organization might have. So some of those questions could be, what kind of compliance failures would create significant brand risk or reputational damage? Could those failures arise internally in the supply chain or in regard to third parties operating on the operations behalf? What is the likely impact of that damage on the organization's market value, their sales, their profit, so on and so forth? You also want to consider questions and look at the key processes or functions that are currently happening at the organization. So we like to think of, what kind of compliance missteps could potentially cause the organization to lose the ability to sell or deliver products. You also want to think about key strategic initiatives. Oftentimes we see that folks have a goal for their organization to kind of drive in a specific way. And with those specific goals and initiatives come some pretty specific risks that might not have necessarily been identified in previous years. And so, how should the compliance programs, design, technology processes, and resource requirements change in light of these growth plans, potential acquisitions, product category or service expansions, et cetera. Additionally, you want to consider how well positioned is the compliance function. Does it have a seat per se at the table when kind of looking at strategic decisions? And so sometimes we see that folks have a really big goal and a big strategic drive, but they aren't necessarily looking at it through a compliance lens. And so you really want to make sure that any strategic initiatives or plans that are set forth, you're really integrating how that relates to the relevant compliance in which you need to operate under. Additionally, we also want to look at, what is the professional exposure? Usually there's executive management or members of the board that are responsible for compliance. And if non-compliance does occur, kind of what does that exposure look like for them? As well as, just like the general cost. We like to think that total compliance does unfortunately have a cost with it, and that goes beyond traditional salaries and benefits of the centralized level, but really what kind of fines or penalties or litigation could an organization face with non-compliance? Do they have the resources they need to cover those costs? So really a lot of questions to ask oneself and kind of ask within the organization to see how well they are set up going forward. We also want to look kind of at the risk considerations. So as we've mentioned previously, exposure and risk is something that occurs on a continuous basis. And so when looking at what you're doing now, that is going to be very different than what you want to do in 3 to 5 years. But it is also very important to make sure you're monitoring those emerging risks that could potentially come up. And so a risk that you have today might not be relevant in 2 years, and a risk that's on the horizon might not need immediate action now, but really might need to be looked at, in 2, 3, 5 years, so on and so forth. And so it's really just making sure you're consistently being introspective, consistently evaluating the environment in which you operate in, and being able to kind of navigate that potential exposure in which you might have. We also want to consider processes or functions that lack mitigation or could affect and impact operations, as well as wanting to consider the key transactions that the org might be considering or strategic initiatives, again, like previously mentioned. So when looking at the sources to kind of identify entity-wide risks, it's a pretty exhaustive list. There's a lot that an organization can do, and there are strengths and weaknesses to kind of everything. But as we've mentioned, consider the organization's strategies and key initiatives. If you have a goal in mind of where you want to go, that probably is going to drive specific risks for the entity, as well as I know Melaney mentioned on a previous slide, usually hospitals and healthcare entities are under a ton of regulation, either at the federal or state level. And those regulations, as I'm sure everyone knows, are constantly changing. And so you want to make sure that you are up to date with any of those changes and making sure that someone is monitoring those within the organization to make sure that something doesn't inadvertently get missed as these rules and regulations are consistently changing. You also want to consider innovation. As I'm sure, again, everyone knows, we operate in an environment where there is consistent change and things are constantly coming to light. And so I know a big one over the past few years has been AI, thinking about how technology can change and how that can drive potential risks within your organization. And then, again, evaluating kind of the OIG work plan. Melaney will go into more detail on a later slide, but the Office of the Inspector General has some great resources, work plans, audits, enforcement activity that one can use to kind of leverage and use as a starting point as a way to kind of identify those risks. Again, additionally, as previously mentioned, a ton of federal and state regulations, the FDA, OSHA, everyone operates under different state and federal agencies. And so just making sure you're up to date of the rules and regulations that currently affect your organization with the agencies that you are under is vital to making sure that you are able to identify the appropriate risks. And then one thing that should be heavily leveraged if possible is any prior internal or external audit reports. Those are a great resource for potential risk and areas of improvement. Those usually come along with a corrective action plan. And there's just some great ways to, if there was a risk that was identified in a previous audit, you want to definitely make sure that that has been addressed and is no longer necessarily an issue, or if it's no longer relevant, and just leverage those work papers of work that has already been done to help kind of mitigate the risk in which you see. And then also looking at data, if there's a way to leverage data within your organization that can kind of identify outliers or trends that could lead to potential risks within the organization, that is a great resource as well to use. And then Melaney, I believe you wanted to talk a little bit about this slide.
Really appreciate it, Tyler. So yes, while there's not a lot of different pieces on here, these other sources of sources for risks, like we have mentioned, the OIG has a work plan. And on that website, there is all for the year, and they add items on an ongoing basis. So there's lots of great information to find out about what's on the mind of OIG. And why that's important, it's not just going to be specific when we think of federal healthcare compliance requirements, so what might fall under STARC or NA kickback or those. There's also items that definitely could touch finance as an example that comes to mind, and I hope I don't cause some trauma response with this, but provider relief funds, the OIG has some of those items on their work plan, and at least one report has been published already. So it's just some really good information for where we can think about where we have some risk as well. But also, the OIG does have a newsroom, and we've included that link here. So lots of great information to stay on top of about what's top of mind for the OIG that usually can be some good insight for us as well. The other one I wanted to talk about is the ASHRM, which is the American Society for Healthcare Risk Management. And they have a document, we've included the link here, that has various risk domains. And we have found using these risk domains can be very, very helpful in our risk assessment process, because we can take the different risks and we can associate them through these different domains. And it really just helps for a visual aspect of where, if we see risks spread out throughout our organization, top risks, or if it's clustered in some ways as well. So this is a good document to consider having sort of in your toolkit as a reference point. And then the other last one there is those roundtables with peers. I don't know if there's ones in your area. We have helped facilitate them in the past, but what that is you get together with folks in your kind of local area, and you talk about what risks are relevant. There's usually a specific topics that are a little bit more in depth that goes into, but you also have knowledge sharing. What sorts of risks, how are you handling those risks? So it's just a really wonderful opportunity to, in some ways, validate. Also, pick the brains of your peers in an informal, yet it's been in person, especially now that we are more frequently getting back together, but also virtually as well. So something to consider also. Thank you, Tyler. Appreciate the opportunity to chat through that slide. Oh, and Amy, I guess we have another polling question, number 3, geared up here.
Oh, all right. So the third polling question is my comfort level with identifying entity-wide risks. And your options are A, old pro, B, been involved in at least one risk assessment, C, learning the ropes, D, no involvement yet, but will soon, or E, not involved as part of my organizational duties. And then as a reminder, if you would like to receive CPE credit for today's webcast, you will need to respond to at least 3 of the 4 polling questions, and then make sure you hit that submit button.
Thank you, Amy. I don't know about all of you, but oftentimes when I'm participating in a webcast, I definitely have some of my certifications where that's always on my mind, getting my CPE. So much sure we get those answers so we can meet those requirements to get the most bang for our time. And also, as a note, if there are any questions or comments even, feel free to put those in the Q&A section, and we'll address them as we're able to as we go, and then also definitely follow up afterwards as well. Okay, so looks like results are in. Most folks have been involved in at least one. A lot of folks not part of the duties that they were involved with. It looks like a good chunk of you, about 20%, are old hats at this. So that is wonderful. All right, Tyler, I think you've got some more you're sharing as well. Okay,
yep.
Perfect.
So now we've kind of moved on to broadly identifying risks, and now we're going to kind of focus on this term called environmental scanning and kind of how we can narrow down those risks potentially. And so when thinking about what an environmental scan is, it is kind of, I like to think of it as a powerful risk management and strategic planning tool that entails careful monitoring of an organization's internal and external environments to detect early signs of challenges and opportunities that may influence an organization's current and future plans. And so the way we do this is by taking a comprehensive look and a systemic approach to collecting and analyzing information, both with internal and external members of the organization, and then kind of taking all that information and letting it drive the planning and forecasting that an organization might do related to the risks. It can also be leveraged when trying to drive the organization to a preferred future. And so again, that's kind of aligning with those strategic goals. If there's a very clear-cut goal and strategy for the organization's future in mind, we can focus directly on kind of how we want to drive towards that, so on and so forth. And so it is currently being integrated into a lot of risk management programs, with the objective being to identify potential opportunities as well as the potential threats, kind of detecting large events, which could include economic events, environmental events, political trends, anything kind of like that, a pandemic, I guess. The full process of environmental scanning also allows for an organization to look introspectively to help gain an understanding of the strengths and limitations of the organization. And so this next slide, I will admit it's a little busy, and I believe it's busy kind of for a purpose, because I think it's really easy to think that entity-wide risk management doesn't necessarily actually include the entire entity. And I think this graphic kind of shows that it does. So when looking at potential stakeholders when doing the environmental scanning, we really like to look, both internally and externally. And so when looking at internal stakeholders, it is so important to remember that each party is involved in kind of different areas of the process and of the work that happens at an organization. And so, like I mentioned, someone who works on one team will likely have completely different risks as top of their mind as opposed to people who work in other environments. And so by being able to kind of pull so many folks and communicate with as many folks as you can across the organization, you're really able to get a pretty comprehensive look at all of the potential risks and areas and pain points that the people who work at the organization day to day are really facing and really worried about. And then similar for external, you kind of take it through a different lens, and we need to look when scanning these risks to make sure that it's comprehensive and exhaustive, and that we're, again, talking to as many folks as we can, because when you're doing these risk assessments with people, I've noticed that we'll talk to 30 people and there will be 30 different top priority risks on their mind. And so really just trying to see what is all out there, what is top of mind for people's, or what is on their mind, and being able to really kind of drive the conversation from there. Because again, what someone might think is a risk as like a top 5 risk, someone might not even have on their radar at all. And so being able to communicate with as many folks as possible really, really helps drive the risk assessment going forward. And then Melaney, I believe you're going to be able to talk through the techniques for environmental scanning.
You bet. So when we think about this, lots of different ways, and obviously as Tyler has mentioned, there's many, many different inputs that we can glean information from. And, oftentimes we might think about it and just take a look, say, at our healthcare realm, because that's the focus of our business. But really good to look at a more global perspective, because what's happening in one industry could actually have an effect on ours, not just from a standpoint of, like, let's take the example of the banking industry, the financial industry, and some of those smaller financial institutions closing and how that could affect us as an organization, but also risks that they may be encountering could be similar to ours. And so it can help give us some ideas. And when we think about this, that's where that first one of reviewing the literature broadly is think about, okay, so here's this very specific thing, but how could that potentially affect us in ways we hadn't yet considered? Thinking about, and Tyler mentioned this, surveying or just informal conversations with employees, key stakeholders, vendors, all of those folks have really good information and insight to share. And a lot of organizations, as an example, will use their, say, insurance provider. They are really good at attuned to risks, but that's likely there's a much broader set of risks that will be applicable for an organization. And so also, depending on the breadth and depth of one wants to go as far as gleaning input, some organizations have held cross-functional group sessions, meaning we bring somebody in, usually say 5 to 7 folks from across the organization. So that could be somebody from risk, from finance, from compliance, from facilities, and we all just kind of talk about what are those risks as a group. There can often be great synergy when that happens, and things will be thought of again in different ways than might have otherwise come about. So all kinds of different techniques as part of that environmental scanning process. And when we think about this, so the culmination of the, say, identify step, which includes the environmental scanning, is really we have a universe of risks. And there's no magic number as far as the number of, say, risks in your risk universe. But as an example, I knew of one organization, and they had upwards of 800 to 1,000 individual risk items, which I might purport, depending on, I guess, the complexity and the size of an organization, maybe so. But for most of us, that would be too large, like just really a much larger universe than could be feasible. So if you are finding you're putting together, maybe some of those could be combined together to make it a little bit less arduous when we get to this assessment stage, which is really kind of thinking about getting that priority of the risks, because we all know we cannot address every single risk that our organization faces. So we have to have a method to identify what are those really top risks. So then we can say, what are we going to do with those? And oftentimes that's considered on a likelihood that something adverse will occur, as well as the magnitude. So what would that mean for us if that particular risk did come to fruition? And then things get ranked based upon that assessment of the likelihood and impact, or magnitude. So again, magnitude, consequence, impact, all synonyms for the same thing. When we think about that, oftentimes it can be helpful to put those together in quantifiable categories. This is especially for us if we're just going to be going through the risks based upon what we know of the organization and we're going to be assessing. There could be different scales. What we see here is a alpha on the top, so E to A, with a categorization to help for this. Also, if we think about the magnitude, a numerical system as an example. This helps us to be consistent when we're assessing the risks, as well as gives, like I mentioned, a really good just frame of reference for considering how we're going to rate and rank the various risks. This here also is, I'm a big fan, especially when we're looking at this, of more visual representations for this. Like, all of us can take a look at this and just automatically know if we see something in the red, that's not good. That's going to want our attention. And this is just an example of how one can take the scale, that 1 to 5 and the A to E, and color code those so that for risks that will fall within those categories, they will help drive what we might want to do with that. So we've got everything from the high red down to the green, and you can do anything in between. You could take, as an example, and alter this that would fit your organizational level, but just an example of a visual representation of a matrix. And when we think about this as part of that assessment process is, we have taken our risks. So let's pretend we had a universe of 150 risks to begin with. We have talked with folks around the organization, either through a survey. And I will say, surveys can be very, very good. They have some challenges in the fact that oftentimes the response rate is on the lower side for surveys. And also, it is difficult to ask follow-up questions based upon the response that an individual might have to a survey. But they definitely can have a place in an organization. Oftentimes, what we have found is most valuable is to meet individually for a brief period of time, 30 minutes, with the, say, senior leadership at an organization to talk through that universe with them of what are those 5 to 10 risks that, as they read through the universe, what resonated with them and why. Really, that key is why. Like, why did that risk bubble up for you? And then also ask for a ranking of that risk, as far as like oftentimes a 1 to 5 from their perspective. What's also very, very helpful is what this will help do is shake out the top, say, 25 to 30 risks based upon all of the individual information that comes. We've also facilitated group sessions, again, that cross-functional group sessions with the same idea. Tell us what are those 5 to 10 risks that bubbled forth for you from that universe and why. From those 25 to 30, usually that's even too many to say we're gonna audit every single one of those, or we're going to have some kind of activity around those. So oftentimes the best next step is for those top 25 to 30, schedule time to talk with the process owner who owns that risk and ask them what activities are in place around this risk. Really what we're asking is what controls do you have in place? But for operations folks, that's not often part of their everyday vocabulary, vernacular. And so it's just much better to talk about like what activities are in place. We've listed here different controls that oftentimes are in place. Other things can come to light that will help us to prioritize risks. So for an example, we have asked in the past and have found out that for a particular risk, there is, say, a new system that is going to be put into place, or there are upgrades to a system that are intended to address that particular risk. And so it may not make sense right now to go and have activity around that particular risk area. It might be better to wait until after that new system is up in place or that upgrade is up and functioning to take a look to validate it did address that risk. There can also be great value in looking at that, especially if it's a brand new system, looking maybe at the processes around that risk ahead of time to help identify things to consider when implementing the new system. So great value to understand related to your top risks. What are the current controls in place to help ultimately decide what we're going to do with those top risks? And they often will actually, if you get your top 30, those will often, based upon the assessment of the controls around that risk, get re-ranked as a final ranking as well. This here is a representation of some various aspects. Again, pictures really can be worth 1,000 words. Different heat maps or presentations of where those top risks fell of those, say, top 25 to 30. I would say really want to consider, you do not need a fancy program to do this, first of all. Most of these, in fact, all of these could be done in Excel. So, and there's great tutorials out there through a Google search. Also always happy to talk with folks about it as well. But I would say we want to consider what would be the visual representation that is the easiest for the end user, so stakeholders, boards, committees, to see where do these top risks flow. This one over here on the very top left corner, probably would need a lot of explanation for someone to easily be able to understand what we're looking at. So things to consider. I personally the back right one speaks to me because I think you can see the bright red ones and into that first quadrant, really those naturally would be where one would think to look to focus. So visual representations, not hard to do. Always happy to talk about that for anybody who's interested. This here is just a real specific heat map that true kind of life example. I would say when we look at this, and I think we would all agree, there is an awful lot showing up in this red quadrant. And I would purport that if we do end up with a heat map that looks like this, we need to maybe do some revisiting to some of the parameters that were looked at, because this, or we really want to have some concerns about the organization. Really, that's a lot to be in the red to try and figure out what we're going to do with. But nonetheless, it's an easy, quick visualization of the risk landscape, if you will. So thinking about this, now that we have gone through our universe, we have solicited feedback and input of the top risks within our organization, and we have prioritized those, we get to really a work plan. What are we going to do that? And I think the most important aspect of this is to really think about this from the context of, if we go to the process of identifying and prioritizing these risks, we can create a lot of risks for ourselves if we do nothing with that information. So it's really important for us to take those top risks and make sure that we are doing something to address those risks. And the top part of this slide really just highlights, if you will, what different sorts of actions can be taken. So of those lists, when we think about avoid, that is where there could be a segment of business that we just absolutely decide as an organization we're not going to get into, or we are going to get out of that business. Transferring it, that's a lot what we do with getting our insurance, reducing it, other ways to mitigate that. So all these kinds of things, where usually in our world is around the audit and monitoring piece of it, because still I would report, even if we have, aside from avoiding, reducing it, accepting it, transferring it, we still have some risk we are responsible for. And so it's good for us to make sure that we are at least monitoring risks, but finding those that we really want to audit, whether that be our internal audit department does it, or we contract out for those audits around those risk areas. And this here, again, some of these slides, in the interest of time, we just want them to be there as resource pieces as well. But this is just some bullet points around ways to reduce risk profile as well. Again, I think the second bullet point is really a good one to think about. And it comes back to this whole notion of continuous risk assessment process, because as we refine our risks, as we identify them, as we monitor for them and make adjustments, and as we do audits or monitoring around those risks too, it really enhances us and our ability to kind of help mitigate the risk around our organization and take on things. Talked much detail around that environmental scanning process. I think that's a wonderful thing. So much information is out there and available. Sometimes I think the risk becomes just too much information and we're on overload a little bit. And then again, designing those auditing and monitoring activities, becoming a lot easier with more hardy and robust tools these days. But these are just, again, some more ideas around reducing that risk profile. And again, some other ways here also. I think the last bullet point is really a really good one to think about in some detail around sometimes investments might be needed to address those risks, which can be very hard in our organizational landscape because margins are low, and oftentimes organizations have recovery efforts in place. But sometimes, and that's an organizational specific contemplation and endeavor, but something to think about is what might we need to invest in to really help us adequately address our top risks. I want to take a moment real quick because we've been mentioning auditing and monitoring, and there are very distinct activities. So when we think about monitoring, those are ongoing real-time activities such as exception reports, scrubbers if we have a claim system, data analytics, once we can get, it's an arduous process, but once we can set up data analytics and have those run, they can really help us identify areas of risk. And an example, not just on the, say, the compliance side of the house, but I think on the finance side of the house, in this example, is say if we have a purchase card program at our organization, we can set up some queries to look for such things as certain sorts of transactions that might fall outside the confines of what's allowable. Also, as we know, for us on our clinical side, wage and hour is oftentimes one of those really top things at an organization. Lots of queries that can go on as well out of your different systems to look for some things to help dive deeper. Auditing, on the other hand, is an independent process of where we go back in time and we take a look at a process or some sort of a process and validate things were working as intended. And this is usually looking against policies, procedures, laws, regulations, and just validating. And the value of this, when we hear that word independent, is true internal audit and auditing are not part of operations. So the self-monitoring activities that a department might do is oftentimes referred to as auditing, but by the definition of auditing, really that's an independent and separate section of the organization. So having external folks come in definitely meets that kind of qualifying piece of it. But if you have an internal audit department, that they would be going in, taking a look. Again, it's a retrospective action. And then we have some examples of, I mentioned a couple. Here's just some other examples just for perspective purposes of what would we consider monitoring pieces. I really like this other one here around your ethics or compliance hotline, or even your fraud, waste, and abuse, as it might be called. Those are real good monitoring pieces as well. So one thing I always like to say is, if your organization, you do have your hotline and you're not getting very many calls in, that actually could be a sign of a risk. We live in a very complex, very highly regulated environment in healthcare. And so there should be lots of questions coming up. So that can be one area to take a look at as well, is how much do we really have coming in through our hotlines. And this is just a brief slide on thinking about designing an internal audit and kind of 9 sort of overarching steps around this. I will say this, what's super important that helps us get to that reoccurring circle back from a risk landscape perspective is really those corrective action plans, also often referred to as management action plans. So that's really soliciting for any, whether it's called at your organization findings or observations, what are management action plans to address that, and the follow-up of them. That is one of the key pieces is, it's really good to solicit management's what their detailed action is, who's going to be the point person responsible for that action, and when the action will be completed. But we want to follow up on that to completion and resolution. That's where when regulators come in, that's what they're looking for as well, is how well are you? The other thing I will say around this is a circle back loop on findings, recommendations. Is there policy and procedure updates that should be made based upon the results of that? So that's all kind of wrapped into the whole risk landscape and reducing and mitigating risks and preventing them as well. Oh goodness, it looks like here we have our 4th polling question. So let's take a moment and go through that. Thank you, Amy.
All right, thank you. So the last question is, my organization has an internal audit function, and your options are A, yes, for quite some time, B, yes, just getting one up and going, C, not yet, but organization has been discussing, D, no, and no current discussions underway, E, internal audit is fully outsourced, or F, I'd like to chat more about internal audit.
Wonderful. Thank you, Amy. And I find it interesting too, when I think of organizations these days, we've sort of been seeing a shift over some time, whereby historically, for as an example, internal audit might have been a separate function, risk might have been a separate function department, and compliance might have been their own separate function. And we're starting to see some instances where that's kind of coming under one umbrella and under sort of one overarching department. And just curious, if you have time and are inclined, maybe answer or in the chat or the Q&A, how that is for your organization. Do you have it now kind of being more and more combined under one larger umbrella, or separate and distinct still?
All right, I'm going to close this one out.
Okay, perfect.
Here are the results.
Thanks, Amy. Wonderful. So majority of you have had an internal audit department or a function for quite some time. And hooray, about 5% is getting one up and going. That is no small feat, but super exciting times. And most of the rest of you, some of you have it fully outsourced, which is super helpful. And great that some of you are on that road to discussing as well. So I think that's fabulous. Thank you. Okay, so with our last few minutes, going to talk through some of the top healthcare risks areas that we're seeing, and see kind of how this bumps up. And I will say again, as Tyler mentioned, as we've had throughout, it is always changing. And so when we think about some of these, cybersecurity, I think that is just going to have to remain on our list. It has been historically what we often see is like in the top 5. I think we're hearing that it is anticipated to bump up in the top 3, if not the top 1. I think it's vying across some of these other ones. But emergency preparedness, and always something to think about. Every organization to some degree either has requirements based upon their entity type for this, but really being prepared and what that looks like. And I think, coming out of the pandemic, a lot of us feel like, we went through, like, this was horrible to go through, and really highlighted some things for us. And I think really the thing with when we think about emergency preparedness is thinking about what is the next sort of disruptor that could completely come out of the blue for us. Like, what would we never imagine? And how are we prepared for that? I know that's a weird thing to say. It's like, what could we not imagine? But that's, I think, again, where the environmental scanning really can be helpful to take and apply to our environments. Violence against healthcare workers, we hear over and over again, especially outside of now that we're beyond the pandemic, there's just more family members, patients, and just oftentimes healthcare workers are just not feeling as safe as they used to. Boy, howdy, the third-party vendor management. I'm not going to say the name because I think there could be some trauma responses there as well. But really in light of, I got to kind of say it. So in light of, say, the Change Healthcare situation, what has really highlighted for a lot of organizations around what can we do? How can we really reassess our vendor management, our vendor risk assessment processes to try and anticipate and protect ourselves against something similar in a different avenue around third-party vendors. A lot around care coordination and delivery for a variety of reasons. The nurse and clinical staff retention and recruitment, we're seeing this pop up again. It's just one of those things. It is, as we know, it is far less expensive to retain folks than it is to try and recruit for them. So a lot of organizations, this is showing up on their top kind of radar. I would say really those JV, affiliation, partnership management and oversight areas, it is oftentimes they're there. Who's watching these? Who's monitoring for these? Those are all really good questions because there can be significant risk in these sorts of agreements. A lot of these other ones, wage and hour, already mentioned that. It is just one of those things, you read the court cases and algorithms in your software are creating challenges. It's just always something, and especially because a lot of us have union contracts we have to deal with and other pieces, state laws, especially if we've got activity in multiple states, making sure that we're following all of the state. Some states you have even local jurisdiction wage and hour requirements. So planning for those new medical technologies, I think that AI, as Tyler said, that is a big, big thing. A lot of discussion coming about for those. But nonetheless, this is sort of what we're seeing as some of those top 20s. So cute. not cute, I apologize. So interesting to see how these might bush up against yours. As a note, there was a quick question about what does JV mean, and my apologies. It is a joint venture agreements. So a lot of those have been in place for years. And again, I've seen some very interesting language in joint venture agreements and affiliation agreements. Super important to kind of know what those are and making sure that we're adhering to those as well. Now, when we think about topics on internal audit plans as well, and I apologize, this is going to be a lot of a duplicate of the prior one. So I'm going to scoosh on by this one. I think all of them are there in some form or fashion. The nurse and the physician, a big one. We know there's a shortage of physicians. So what are the strategies to get them in? Okay, so also, because in our healthcare world, compliance is huge. These are some strictly, when we think of healthcare compliance, kind of top topics that we see coming up. So hospice is really big on the landscape. A lot of folks are getting hit with kind of areas around this. We know the telehealth, there's a lot to it. It's still in flux about what's going to become permanent, what's going to be extended out. This incident too, and split shared and billing, that has been popping up quite frequently, that we're seeing folks that are kind of noticing they might have had some trip ups in that area. Always taking a look at physician compensation payments and the agreements around that. Some of these other ones, we can read them. The risk adjustment factor, that's really big, especially with the changes and how that might be. So anyways, these are just some of the ones. There's a whole slew of others, but just, you know, how are these bumping up against what you're seeing and hearing at your organization? Okay, so as a wrap up, and we can look for a couple questions. We'll have probably a couple minutes left over as well. But, you know, thinking about our time together today, we talked about why risk assessments are really important for an organization, reviewed some of these considerations for conducting risk assessments, and then also talked about some of these top risks that we're seeing others are facing in the healthcare landscape. And just a really good time. And again, happy for if there's any follow-up questions as well. You'll have Tyler and I's information. Feel free to reach out. Also wanted to, real quick, because this is something that Moss Adams has sponsors a healthcare executive conference coming up in November 6th through 8th. It amazes me the great keynote speakers and presenters that come for this. So wanted to provide a little information about this. And here's a little snippets of who our keynote speakers will be, but definitely encourage, check this out. It's a great time. I hear great feedback from folks who attend. Also part of that is, oh, I need to click here. Moss Adams has a program for the women's lead that's called We Lead, and they also have some time as well, but here's some information about this. We'll be have a forum at the healthcare conference, but always happy and can provide some more information about this as well. I've attended the past couple times, and I will tell you that, again, the keynote speaker they get for this is just fabulous and great information as well. All right, we have a couple minutes. Let me look through here and see if there was some questions. Okay, great. We had one person that had said they did have clinical pathways and clinical guidelines department. Risk management department was actually completely separate, independent, and now they have come together, which I would imagine that has been a really great synergy to kind of bring those together under one. So I think, thank you so much for sharing that information as well. And then I guess with that, we do have 1 minute left. So I apologize, Amy. I think you've got some final words to say as well.
I do. So yes, we are out of time, but thank you, Melaney and Tyler, for a really great presentation today. And to our audience, if you do have further questions or comments, please reach out to us and we would be happy to continue the conversation. You can drop a note now in the Q&A window or reach out to the presenters directly. Their contact information is in your console as well as in the slide deck, which you can download now from the handouts window. And then if you met all CPE requirements, your certificate is available to download now in the CPE progress window. A copy will be emailed within 2 weeks as well. And finally, here's a link to a survey for today's presentation. Oh, here's the survey, a link to the survey for today's presentation. Your feedback is always appreciated. And again, thank you for joining us, and take care, everyone. Thank you.